All right, it's about that time. It is 2:15 here in Grand Forks, so we will get this started. Um, my name is John Bernstrom. I am the work in the Public Information Office for the City of Grand Forks. On our afternoon virtual news conference today, we have Mayor Michael R. Brown from City of Grand Forks, Dr. Josh Deere from All True Health System, and Deb Swanson from Grand Forks Public Health. Also on the line, we do have Dr. Terry Brenner from the Grand Forks School District and Mr. Todd Phelan from the City of Grand Forks as well, if questions during the Q&A want to be directed towards them. But we will have statements from Mayor Brown, Dr. Deere, and Deb Swanson as part of the news conference. Once the statements are done, we will go to a 15-minute Q&A with the media. So please feel free, use the raise hand feature on within this Zoom meeting to get my attention that you would like to ask a question. I would then unmute your mic and you can pose your question. So we'll start first with Mayor Brown with opening remarks, sir.
I want to thank everyone for being informed. Please make sure you're following reliable resources of information, as there's a lot of misinformation out there. We have a variety of resources available at grandforksgov.com resources, where you can find information on food resources, home utility resources, and access public health resource pages. There are currently 11 cases of COVID-19 in Grand Forks County. Here's your daily reminder on physical distancing. You can't spread the virus if you do not get the virus. That is why it's so important that you stay home. We strongly discourage group gatherings, even small ones with a couple of friends. We've seen evidence of community spread, which means the occurrence is not confirmed to be related to travel or close contact. After discussions with local leaders around the state and insights from Governor Berger's administration, we have adequate measures currently in place, if followed, to protect Grand Forks. The governor has been proactive and has responded prudently to this pandemic. With that being said, we're closely monitoring the situation and will act locally if necessary. Our police department is actively monitoring, educating, and community policing when it comes to COVID-19 related restrictions and recommendations. We also encourage everyone to stay alert and keep your property safe and secure while at home. I'm happy to see our big shopping centers and local businesses have ramped up their mitigation efforts on their own accord. They're doing the right thing, and I applaud them for taking action and keeping the public and their employees safe. There are resources on the city's webpage with signage recommendations and best practices for businesses. Businesses and organizations are making tough decisions and doing what is necessary to sustain our economic and social well-being. They are focusing on keeping our organization and our people strong in these difficult times. Our finance department is working on a frequently asked questions document for local restaurants and further guidance regarding the executive orders I passed to assist them as they transition their businesses to delivery, takeout, and curbside pickup. We've been working with our local, state, and federal partners regarding economic and social sustainability operations through the participation in listening sessions and coordinating CARES Act related business with our congressional delegation and Governor Burgum and his team. The smaller the valley of negative impact, the smaller the climb of recovery will be. As such, I'm working with our city staff to reprioritize our community and economic development strategies in response to the COVID-19 pandemic, with the full understanding these times will pass and new strategies will need to be in place when this is over. Additionally, I encourage Grand Forks small business owners to apply for the Paycheck Protection Program enacted as part of the CARES Act. This is a 1% interest loan that you can apply for at your local lender to use for payroll, rent, mortgage, or utilities. It's a first come, first served loan and only available to the 30th of June or until the funds run out. It will be critical for our small business survival, so please make sure you apply. For more information, please go to ndresponse.gov. Our flood protection project action plan has been implemented with street and greenway closures and activation of flood pump stations. Thank you to Public Works and Waterworks crews who are executing the plan in a humble, calm, and professional manner. We're also monitoring the situation and ready to adapt to changing circumstances. To close, remember physical distancing is imperative in slowing the spread. The virus does not spread itself, we do. Stay in place, maintain your space, and cover your face. Stay home, slow the spread, and save lives. We're in this together. We'll get through this together, and together we'll emerge stronger. Thank you.
Thank you, Mayor. We'll go next to Dr. Deer from All True Health System. Go ahead, Doctor.
Good afternoon, and thanks again for the opportunity to provide updates on All True's response to COVID-19. As our community experiences a growing number of positive cases for COVID, it is important that we remain vigilant in following recommendations, but do so in a calm, thoughtful manner. I feel it's helpful at this time to share a reminder of the ways All True is prepared to screen, test, and manage care for those who may be at risk for COVID, all while continuing to care for our general patient population. Our screening hotline continues to be used as it has over the last several weeks. Our curbside testing allows those who meet guidelines to be tested without entering a clinic building. Our sick clinic provides an environment for anyone with respiratory symptoms to walk to have a scheduled appointment. Respiratory symptoms are sometimes confusing to the public and providers and everyone else. These conditions include cough, fever, shortness of breath, sore throat, nasal congestion. This clinic is staffed by our primary care providers and pediatric providers. Starting today, we are changing hours and expanding this from 7 a.m. to 7 p.m., Monday through Friday, and Saturday and Sunday from 10 to 3. All of our locations have restricted visitors and are screening all individuals who enter our buildings. This is for the safety of all. We've set guidelines for use of masks, as it's important for our staff, patients, and visitors. We also have a tiered set of plans for caring for patients in the hospital setting and feel well prepared to accommodate anticipated needs. All of these operational changes and additional precautions are in place for one reason: the safety of our patients, staff, and community. As we manage through community spread and anticipate additional cases, these measures will continue to help mitigate spread and keep your community safe. Thank you to the businesses and individuals who made tough decisions to make changes for the greater good. Adjusting how you operate is not easy, but is necessary during this health crisis. Thank you.
Thank you, Dr. Deer. And we'll go next now to Grand Forks Public Health Director, Deb Swanson. Deb?
Thank you, John, and thank you to everyone who's joining us today. Grand Forks Public Health Department has been very busy, just as the City of Grand Forks and All True Health System have. A significant percentage of our time right now is spent on investigating the cases that have turned out to be positive tests. And this is a very time-consuming but very important part of our activity. One of the things that we have discovered through this process is that there are a number of individuals that are probably still not following all of the guidance that we have recommended. At this time, we greatly appreciate the public support in all the activities that have been mentioned, such as staying at home, limiting people who come into your home, and not going to others' homes for social events. Likewise, we want to really reiterate the importance of, if you have traveled anywhere, to make sure you complete the document on the health department's website to determine whether or not you need to self-quarantine for 14 days. This includes 31 states, as many more states are being added where there is widespread disease, and also anyone who has traveled internationally. Another important thing I wanted to touch upon today too is the evidence out there surrounding masks and their use in some additional environments. We initially gave people information based on how we knew the virus was spreading in other countries, and now we have more information that indicates there is probably some benefit to people wearing masks in additional places. You've heard about masks being used for visitors at hospitals or other locations. We are now recommending them for all routine care and long-term care, and also when people go out to do their essential business, with a focus on essential business. Masks help protect you from spreading disease to others, and likewise for others spreading disease to you. So our simple message here is my mask protects you and your mask protects me. However, we don't want people to be complacent about that message. It's still important to have physical distancing, to follow all the guidelines for travel and everything else that we've recommended. So far, Grand Forks County has had a low number of cases, but we anticipate that that could change. We really want North Dakota to remain a place where this disease is not widespread, but it will require cooperation from everyone. Our goal now is to prevent a surge of cases that would require hospitalization or care. And that gives us some time to build capacity in the health system and also to expand our testing to more people. And this will continue until such time as we have a vaccine to prevent this disease. So once again, we appreciate all the cooperation that we've received from the residents of the city and the county of Grand Forks. And I can't say enough about the messages that have already been provided by others on this panel. We fully recognize the difficult decisions people are having to make, the sacrifices every day, and we appreciate that. But we really want everyone to come out on the other side of this as healthy as possible. So thank you for your cooperation. Grand Forks Public Health Department stands ready to answer your questions. We encourage them at our main number 787-8100 through our Facebook page. And then also you can get additional information on our webpage. Thank you, John.
Thank you, Deb. We will now go to the Q&A portion, and our first question will come from KNOX.
It's question, hold on just a moment. Okay, here we go. Question for Mayor Brown. In your statement today, Mayor, you said that after consultations with the governor, you feel like you have sufficient protocols in place to limit the community spread of COVID-19. On Friday, you said that you felt like we were well overdue for a shelter in place or a stay-at-home order. What changed?
I think more information. I was reading the New York Times this morning, and they talk about shelter in place in New York, and we already go beyond many of the things they suggest. So I think as we see with the recommendations with masks changing over time, my opinion changes over time as we get more information. So I think we're in a good place if we can get people to follow the recommendations we have in place, which is stay in place, maintain your space, and cover your face.
Thank you, Mayor. Next question will come from Mr. Joe Bowen.
Yeah, hey there. This is also a question for Mike. It sounds like you had a meeting with some other North Dakota mayors and Governor Doug Burgum shortly after the press conference on Friday. How often do you have those meetings, and what happens at them?
Well, the meetings happen periodically and with either email or texting or communication, various telephone. So I think that we want to stay in touch with each other. What are they doing that's working? What are we doing that's working? And what can we do to make these things work better and get the message out? People, it seems they're not taking this as seriously as they need to, because essential means you only go out when it's essential. If you need a backup sump pump, if you need groceries to keep your family healthy, then you go out. I think it's important we get that message out. Don't go out to socialize, don't go out to shop. But I do think we do recommend physical exercise for your mental well-being. And when you jog 6 feet apart. When you go for a walk, unless it's immediate family, have your distancing. So I think it's important we continue to get the message out and get people to comply.
I see a hand raised here by KNOX. Go ahead, Ryan.
For either Ms. Swanson or Mayor Brown, the latest projections show a peak in North Dakota coming April 17th as far as hospitalizations are concerned. And then the drop off there. What do we expect as far as, is there a time frame right now for the reestablishment of non-essential businesses to open up, restaurants in particular, those types of things? If we have a peak on April 17th, how long after that can we expect a time to go before those reopen?
I think we would follow the guidelines that we're seeing in other countries, but people, this is a long-term event. This is a marathon. You're not going to be back to work 2 days after April 17th or a week after April 17th, or maybe 3 weeks after April 17th. We'll have to get it down to where we feel the numbers are safe. And it's one of those things, how do you predict the future? We don't have a crystal ball. We just have to monitor events as they happen and then be cautious and respond appropriately for the health of our community.
And Deb Swanson, would you like, it was directed to either you or Mr. Mayor. Do you have a comment on that one as well?
The only thing I would add to that is these are complex decisions. They're not made in a vacuum with just the resurgence of cases or cases going down, a lot of factors need to be taken into consideration. What we have learned in some other countries where they did lessen their guidelines, they had additional cases appear then. So we have to be really, really careful not to have a second surge and not be prepared for that. So decisions are not made based on a specific date or a specific number of cases or even one single trend. They have to be made in concert with the best information from a variety of sources.
Okay, I see a hand raised here by Mr. Joe Bowen. Go ahead, Joe. Go ahead, Joe.
All right, thanks. So at those meetings, where you're talking to the governor and other mayors, it sounds like there's not a specific meeting so much as it is a continued sort of conversation. What I'm trying to get a sense of, though, is what's the power dynamic like there? Like, let's say you want more restrictions, tougher restrictions, more enforcement of existing ones, whatever, and let's say the governor wants to maintain the status quo as it is in that moment. Who gets what they want?
Well, I think we come to a consensus. We come to what we think is working. I mean, there's no power play. There's no power struggle. It's just sharing information and then educating. So I don't see it as a power struggle. I see it as more we're working together for the safety of our community and the safety of our state. And like I say, if we get the message out, we'll be a healthier community through this and we'll emerge stronger.
Thank you, Mayor. KNOX, go ahead.
Follow-up question for either Ms. Swanson or for Mayor Brown. So the conversation is we have to wait to see when it's safe in order to lessen those restrictions. We're living in an age of numbers. We get to see numbers. Governor Burgum has used numbers like 1, 2, 4, 8, 12, 16, and so forth, or whatever, 32. It goes from there. So what I'm asking is, what indicates to you, as far as numbers or trends or whatever, that it's safe? Or are we just going to wait for someone that's in a position to say, well, looks safe to me, and then we're going to open things up? What does that look? What are we waiting for as far as a safe level?
I wish I knew, but the economy will come back, but people can't. So I think we take the cautious road and be safe and practice the guidelines that we're given. And we wait until we feel it's responsible to come back. But to come back too soon, as Deb has said, more people get sick and they die. And we don't want that to happen in our community. So I think we be patient, and we can't give you numbers because we don't have a crystal ball. We evaluate things as they happen.
So just a follow up to that, who makes that decision ultimately? Because I know last week you were in disagreement with the governor, at least on Friday, that we needed a shelter in place order. Now you seem to be in agreement with him. So are we waiting for Governor Burgum? Are we waiting for President Trump or for somebody in city government?
I think we're waiting for informed sources to make a decision. So I don't want to impugn anybody's credibility, but I think we have good people in place to discuss this with, and I'm comfortable with the governor and his leadership team, and he's got the best experts available. And our state requirements are different than other states. We're sparsely populated, and we have the distancing that we use. And I think our people want to help each other. We want to protect our community. So I think we have different variables than other states. So I think it's important we listen and comply.
If I could add to what Mayor Brown has said, we have to consider that we have a number of states that still have shelter in place in those states. And this disease started on both of our coasts and worked its way to the center of the country, which is where we are right now. So we're a little bit behind those other states. And I think in some ways that's given us a little bit of time to prepare, but it will also give us a lot of information about when we can go back to opening things up and releasing or relaxing some of our guidance. We won't have to be the first to do that. We'll see what happens in other states. And so I think we also want to look at what's happening around us, where our travel might come from, our bordering states, and see what they do as well. I feel like oftentimes the decision at a statewide level can be good because then it allows us to have that level playing field across all of the areas of our state. But we'll have to wait and see. I think that is a good point, but I do believe that we have other states that will guide us in those decisions coming forward.
people have to realize this is a long-term process, and we're not going to be saying the finish line is here when we don't know where the finish line is. So to think we're going to establish a finish line before we know where one is irresponsible, because then you're criticized for not meeting it when we don't know what the future holds. So I think it's important we realize we're in this for the long haul, comply with our recommendations, and we'll get through this together and emerge stronger than ever.
Follow up to that, though, Mayor Brown, I don't think it's unreasonable for people to ask for some information about what the finish line looks like. So
Yeah,
if we're in a situation where every part of the plan that we have is only for the now and not for the end, I think people deserve to know at least a little bit about what the end game looks like.
I wish I knew what the end game looked like. I don't have a crystal ball. So I would encourage people to follow our recommendations so we come out of this healthier as a community. So no, I don't have a crystal ball. I can't tell you when it's going to end. So just continue to realize this is a marathon. I didn't expect April 17th. I expected June from what I've read. So I think that April 17th might be premature, but we'll wait and see. But together as a community, we can help do our part by staying home and only going out for essential things.
Thank you, Mayor. Waiting patiently is Mr. Neil Carlson. Neil, go ahead.
Hi, question for Dr. Deer. How many ventilators does Altru have? How many are in use? And are there any shortages of any type of medical supplies?
Altru currently has 88 ventilators. Our ICU capacity has not reached surge capacity at this time, so I won't give you a specific number on how many ventilators are in use, but I could get that for a later date. And then as far as medical supplies go, I reported last week that we got our shipment from the state, which was our 40% allocation, which really helped shore up our supplies, our personal protective equipment. We continue to work with our vendors. So from a personal protective equipment standpoint, Altru Health System feels that we're in a good spot to manage this crisis.
Thank you, Dr. Deer. A question from our Facebook feed. Dr. Deer, this is when it comes to appointments. Are well child appointments considered essential, or are those being rescheduled at Altru right now?
Yeah, currently Well Child, if you read an American Academy of Pediatrics released a statement on it. And those that require immunizations, particularly your 2-month, 4-month, 6-month, and 12-month visits, they say that these should still occur in person, because as we're learning through all this, immunizations are very important. Wouldn't it be nice to have an immunization for coronavirus right now? We won't be having this press conference. So the importance of getting those immunizations in at the right time and protecting your little one is important, and we're going to continue to see them.
Thank you, Dr. Deer. Next question, Mr. Joe Bowen from the Grand Forks Herald.
Yeah, hey, this is a Facebook one here. Does Altru have any COVID-19 patients, and has it had any COVID-19 patients?
Looking at Dr. Deer.
Yeah, yes, we have, but due to patient privacy, I can't really expound on any details for you.
Okay, next question from Mr. Neil Carlson. Go ahead, Neil.
Again, Dr. Deer, just to follow up on this a bit. I'm sure you guys have looked at projections of what could be with you said Altru has 88 ventilators. With the projections that are out there, are you comfortable with the equipment you have in place?
Yes, we're comfortable with the equipment we have in place.
Thank you, Dr. Deer. Next question, Mr. Joe Bowen. Go ahead, Joe.
All right, yeah, hey, so this is kind of a longer one, but basically if you compare population of Burleigh County, Grand Forks County, and Cass County with the testing statistics on the Department of Health's website, the North Dakota Department of Health's website, it looks like there's one test that's been performed for every 102 people in Burleigh, one for every 116 people in Grand Forks County, and one for every 128 people in Cass County. Does anyone here consider any of those differences significant in however you would choose to define significant, statistically or whatever?
Yeah, I can take that.
Yeah.
The difference between us and them in those counties, you're comparing counties that are in different geographical locations. They've had community spread for quite a long time, over a week, I think, particularly in Fargo and Bismarck. We have just had community spread really, over the short term. So when you have community spread, Deb can speak to it, but it really exponentially increases the amount of tests that are ordered just based on contacts of that infected individual. So although we aren't leading the pack like we were earlier, we feel that our testing has been brisk, and our statewide testing is really some of the best in the nation if you look at the overall numbers per person.
Thank you, Josh. We have time for two more. We'll go to KNOX.
This would be a question for Dr. Deer. You mentioned the 88 ventilators that Altru has on hand. There are some machines that healthcare establishments like yourselves have that can be converted into ventilators as well. So the 88 ventilators that you have, does that include every machine that you could use, or are there some additional machines that, if necessary, you could put into service as a ventilator?
Yeah, that's our actual ventilator count. I know there's reports in the media and on the internet about things that you can do differently, including splitting them off and doing other things, but our plan is not to do that. And those are the ventilators that we have on hand that could be operational now.
Thank you, Josh. We'll go next to Mr. Neil Carlson. Go ahead, Neil.
Again, Dr. Deer, I've got a viewer here. A couple people are wondering, is there a difference in the accuracy of the test between is it done orally or nasally? Is there a couple of different ways it's done?
The sensitivity and specificity on all the testing is about the same. And it's the testing limiting factor has been the reagent as to how we actually run the test on the analyzer. So they all are very similar.
Okay, thank you.
Thank you, Dr. Deer. Okay, we'll do one more. Mr. Bowen, you have last question.
Well, this is actually a question for Terry Brenner, if he's able to hop on. If not, it's okay.
You know, we can unmute Mr. Brenner's mic. Go ahead.
Okay, so Terry, I'm curious what attendance has been like since you guys moved strictly to online learning. Like, are the number of people showing up for class, quote unquote, about the same as they were when they were showing up to literal physical class?
Dr. Brenner?
Yeah, I don't have that data right in front of me. We've had 3 days of school, 3.5 days of school thus far, but I'll have that ready for Wednesday. My hunch is, based upon principal feedback that we've had through almost daily conversations, is that students are attending, teachers are taking attendance, and where teachers need support, they're getting it from paraprofessionals and other support staff to take attendance. So I know in the case of my own household, our third grader is attending class each and every day.
Thank you, Dr. Brenner. And as we have done with this, thank you to our panelists. Thank you for members of media for joining us. And as we have done in the past, Mayor Brown, can you give us some closing remarks?
Oh, yes, thank you. So we are early in this marathon, and I want an end date as much as everyone else, but there are so many variables, it is irresponsible to give an end date. And I'm ready for this to be over, but it's not going to be over for a while. So again, we would encourage everyone to follow the guidelines. Stay in place, maintain your space, cover your face, stay home, stop the spread, and we'll emerge from this stronger than ever. Thank you.
Thank you, Mayor, and thank you, everyone. This concludes